So my name is Akende Simamuna. I am a social worker by profession. I am currently pursuing my master's in public health, soon to graduate. I work for GIZ for a program called Strengthening Girls' Rights. And so a lot of my work in the past few years has been around sexual reproductive health for adolescents and young people in Zambia. My role with the Zambian Youth Platform is vice chairperson for the Zambian Youth Platform board. It is evident that there is clear discrepancy, well, obviously meaning inequality, between the lives of children in the urban areas that are privileged, that is me, and the average young person in the rural parts of the country. And it may not even be in the most remote areas, it may still be within the urban areas, but in the unplanned settlement areas, for example, where they have poor access to water, electricity, poor housing situation, no access to education, overcrowding. So it's pretty obvious the inequalities that exist generally in their lives, but then also that simply translates into the different inequalities in education and also access to healthcare. So no, it doesn't. On paper, it should, according to the way it's structured, but you can significantly see that it doesn't. I am over-serviced rather, and I have access to all these services because I am in the capital city and in Lusaka, right in the central business area. But what happens to the one person who is in Shangombo, in a typical rural place, and has to walk 8 kilometers to the nearest rural health center that barely has staff? So you cannot say that it works for everyone. No, it doesn't. So it's pretty sad that in organizing and receiving such support, there isn't much much say from the recipient. If, for example, in a household, your issue really is about a leaking roof, and if the help that is offered is to fix a broken window, and you barely have a broken window, then you're not solving anything. You're not helping that particular household. And this, I think, goes to a higher level conversations. There's obviously some agreements at a certain point in time, and that's very high level. But then high level agreements are done in closed door meetings about people who are not aware these things are happening. And I think there is need to still go back to the drawing board. Are you really, truly representing the target population or the target audience for this particular intervention? Have you talked to them? Have they told you they probably need surgery facility more than they need prescription of medication, for example? So I think there's got to have to be a working system, and I think it's there on paper, but is it practical? I do not think so. And local experts are the ones who know how best their populations work, what kind of governing bodies exist to meaningfully engage communities, and even the threats and the barriers that exist in those systems that exist in that particular community, only the local experts who would know. But at what level are you engaging the local experts? And at what level are you also engaging the intended community or target population? So there is need for a linkage across the board up to high level. So I as a young person should be confident to say at a high level meeting my interests are being put first. And in the first place, I need to know that there is even this thing happening, and like just saying that, oh, so now we have a service for you, when I actually needed a different service altogether. So first of all, I would address the barriers that we have since discussed. That is the barrier between the target population and the service provider, the barrier between policymakers and decision makers in the target population. So we can't keep making decisions on behalf of people without consulting them. So what I would do is capitalize on spaces like the Zambian Youth Platform that offer an opportunity for target populations like young people, in this instance, to air their views and make recommendations. Support in-house healthcare staff. I do not think there is anything that the mission doctors would offer that our local doctors are not trained in. They still offer that services whether or not we receive the mission doctors. There's still a doctor that is offering a particular service. So meaning we're professionally equipped to actually train other doctors from our in-house, yes. So probably the support, and these mission doctors do not come here for free. They do get support, I believe, to be comfortable in a foreign place. So if probably those resources could then be diverted to support local healthcare staff that are actually unemployed, then it would be making sense, if you ask me. Again, it still goes back to, even if I say what I have to say to them, of course, I would encourage young people to be more keen, more curious, take an active role, and be inquisitive about what's happening with issues that concern them. But like I said, they have to know that there's even spaces that are there for you to know how these systems work. And the Zambian Youth Platform, for example, is one of those. So what I would say is engage the Zambian Youth Platform. Hold the platform accountable. The platform claims to be representing young people in different developmental issues, health issues, governance issues. Go to the Zambian Youth Platform and say, what are you doing about the young people in my community who do not have access to health care, for example? So it is in those spaces where change actually begins to happen. It is in those spaces where you bring to light actually issues that are not being addressed. So I would encourage young people to take keen interest in things that concern them, because unlike long ago, we do have a collective, an organized space, the Zambian Youth Platform, for you to express all your needs.